State epidemiologist, Dr. Ryan Westergaard, is here to answer your questions. We do have just a half an hour of his time, so we ask you to limit yourself to just one question. We're going to get right to it with John Neisser at NBC 26.
Yes, thank you, Dr. Westergaard. If you could start by just kind of sharing from the news a few days ago about the availability of vaccine for monkeypox. Is that something that will come to Wisconsin? And what type of vaccine?
I missed the last part of your question, but just to speak generally about the availability of vaccine. Anything else specific?
Yes, and what type of vaccine is it?
Okay, great, thank you. So there are two types of vaccines that are authorized for use to prevent monkeypox infection. One of them has been around for a long time, and that is the classical smallpox vaccine called ACAM 2000. That vaccine is not used very often, and it's because smallpox has been eradicated, but there's still quite a bit of it in the strategic national stockpile, and it's used sometimes in laboratory workers and in military recruits, just on the chance that the smallpox could make a resurgence. So smallpox and monkeypox are very similar viruses, and the immune system protection you get from a smallpox vaccine can protect you from developing monkeypox virus infection if you're exposed to it. So that older vaccine is still available, but it's not in wide use. There is a newer vaccine called Jynneos, which is approved by the FDA, but has not been widely marketed, and the supply is relatively low. This vaccine is advantageous for prevention of monkeypox because it's simpler to use. It's a live virus vaccine, but it's different than the original smallpox. It's not a replicating virus. So maybe this might be more detail than you're interested in. But the older smallpox virus uses a special needle, and you cause actually a local infection in the skin, and it causes a scar that some people still have, because that's how it trains the immune system to respond through creating a local infection of vaccinia virus, which is a related virus to smallpox. So the Jynneos vaccine, the new one, is a live virus, but not a replicating virus. So it has fewer contraindications. It's safer to use. But because it hasn't been, we haven't needed it in the past, there's not a large supply. So the federal government has both vaccines, but state health departments that are accessing it are predominantly accessing the new version of the Jynneos vaccine, and it's being used for post-exposure prophylaxis, meaning if someone is exposed to a person with probable or confirmed monkeypox infection, after the exposure, we provide vaccination to reduce the probability of the infection developing. We also use it for pre-exposure prophylaxis in laboratory workers who might come into contact with it. But the key message on vaccine of it is that it is available only through the federal government, and we facilitate the delivery through the state health department. So clinicians should know, and we've shared with them today, the phone number for reaching us at DHS to facilitate ordering the vaccine for anyone who's needed, and we can get it delivered relatively quickly. But it's not a vaccine that's stocked in hospitals and pharmacies, so the procedures are still somewhat complicated. But anyone who does need it, we can access it.
Thank you, Dr. Westergaard. Next question to Tiffany Olson, WKBT.
Hi, I guess my question would be, do you have any information on how this person got the virus? Were they traveling, and if so, from where?
Sure, thanks for that. So we, to protect privacy, we release very little information about the individual who tested positive. And so our standard, and we've done this with COVID and other communicable diseases, is to release the information about the county of residence. And so all we're saying is that this is an adult individual living in Dane County.
Thank you for that. Next question, Casey Nelson, WTAQ.
Hi, thanks for taking the questions here today. Mine is, there's one case here in the state, 400 nationwide. It's not incredibly transmissible. How big of a deal really is monkeypox? You compared it a little bit to smallpox there, but I mean, what is it about monkeypox that raises concern at this point?
Yeah, that is a great question. I think it's important to talk about. So so far, there have been no fatalities in the United States, maybe one in the world out of several 1,000. So it doesn't cause severe disease, and it's not terribly transmissible. But it is a big deal that we make people aware of it, because we don't want to miss any cases. We can prevent and treat people with monkeypox infection, and we can potentially prevent it from spreading and taking hold so it becomes an endemic virus. But we're only going to do that if we catch as many cases as we can, which means making sure that all of our healthcare professionals know what to look for, make sure they know what to do if they encounter a patient, and in terms of getting the right kinds of testing, know the public, local and tribal public health know how to investigate and how to obtain the vaccine. So we're spending a good amount of time, even though there's one case here in public health, to make sure that we're communicating what is important to know about monkeypox. And it's important, I think, and I appreciate all of your work in this regard, to communicate the message not being this is a scary thing, this is a large scale threat to public health. It's important because we have an opportunity to prevent it from spreading widely, but we're only going to do that if people think to test for it. So that's really what's important about it. It's not a trivial virus. I mean, people have died from monkeypox. You don't want it for sure, but it's not something that should cause undue alarm for the general public. It is generally take close skin-to-skin contact to transmit from person to person, and so it's not airborne to a large degree that we know about. We're always careful in healthcare settings that think that virus can be in respiratory droplets, so we recommend personal protective equipment, gowns and gloves and face masks if you're taking care of a patient, but it's not airborne like SARS-CoV-2, the virus that causes COVID-19, and we do not have a great deal of concern that it's going to cause a large pandemic, for example. So it's important for those reasons that we have an opportunity, if we work hard and we use the systems we have, to prevent it from becoming endemic. And I think a better example of what we're trying to avoid is for it becoming like syphilis or herpes, diseases that are not terribly common. They're important and they can cause important morbidity, but we have to be very vigilant to diagnose cases and treat them and get them out of contact with others to prevent them from becoming large scale epidemics.
Thank you. Now to Mark Kruger, Fox 6. Mark.
I don't think Mark's here, but I'm from Fox 6, so I can kind of take it. Thanks for doing this. Just want to ask, knowing this is rare, do we have any idea why we're seeing this pop up at this time?
Yeah, there's some interesting theories on why now, and there's been some experts that have been predicting that monkeypox virus could increase these days. And the most interesting hypothesis that I've heard, and I think that it's probably valid, is that the level of the population level immunity, or you recall we use the term herd immunity, to this virus was pretty extensive because prior generations were vaccinated for smallpox. Since we eradicated smallpox, since we no longer give smallpox vaccine to the general population, the number of people who are susceptible to monkeypox has increased dramatically. Every year that goes by, new people are born who are susceptible, and people who were immune from vaccination are dying. So the conditions were right for this virus, which is endemic in animals, in rodents, to jump over, and in the right environment, it could cause a cluster in a network. And what we're seeing now is transmission aided by international travel, among other things. So I think it's, like all these things, there are multiple factors, but the thing that made it not surprising to some people who have been following this virus closely is the fact that we are becoming more and more vulnerable, meaning less and less immune on a community level to this virus because it has such similarity to smallpox.
Thank you. Now to WKOW, Danny Maxwell, WKOW. All right, let's move on to Ed Walters, WFRV. Ed Walters. How about Isaac at Milwaukee Journal Sentinel? Isaac, you.
Hi, thank you for doing this. I'm wondering with this case that was in Dane County, and I know you can't talk about any specific cases, was there contact tracing done? And if so, have you administered the vaccine in this post-exposure way that you mentioned?
So I would say that the local public health department is doing all the things that they are trained to do and expected to do in terms of investigating potential contacts, interviewing the patient, and following up as appropriate. But I can't share whether we've administered any vaccine related to this case right now.
Thank you. We'll go now to Logan at WISC. WISC. All right, how about Mitchell Schmidt, Wisconsin State Journal?
My question was asked. Thank you.
Okay. Steve Hansen, WIS Community. Steve Hansen. Tiffany Shepard, CBS 58. Okay, let's try Spectrum News One. Spectrum, are you on the call?
Yes, I am. Good afternoon. Thanks for holding this call. In looking a little bit at some of the symptoms that appear to come from monkeypox, it seems like many of them are ones that are consistent, certainly with other, sometimes more minor conditions that people can have. My question would be, at what point should what sort of symptoms or what sort of things should prompt them perhaps reaching out to a healthcare provider to see if they could have been at risk for this?
Sure, the symptoms that monkeypox can cause are similar to chickenpox or varicella zoster virus, which causes shingles and other herpes virus. So it causes small skin lesions, which we can call pustules or vesicles. Sometimes they appear to have fluid in them. Sometimes their skin can be red. The characteristics, what the word pox means, is actually these small lumps. People who have ever seen someone with chickenpox, it's more similar to that. So not a flat rash that you see all over your body, but discrete bumps. In addition to that, it's a virus that causes systemic symptoms. So fever, swollen lymph nodes, the type of fatigue that you get when you have the flu, but importantly, not cough or sore throat. So we don't call it a flu-like illness, but it can make people feel run down, fever, and like I said, swollen lymph nodes. In this current outbreak globally, it turns out that it has been transmitted through sexual or other intimate contact more commonly than we anticipated this virus would. Now, it's not traditionally considered a sexually transmitted infection, and it's certainly not limited to transmission that way, but it has any skin-to-skin contact with the person that has skin lesions can result in transmission. So it's important to know if people have symptoms that resemble other STDs, like herpes, for example, and they've potentially traveled to a place where they also heard that monkeypox has been diagnosed, that would be a signal to go and get tested.
Thank you. Let's go now to Jenny Peak, Wisconsin Public Radio.
Hi, thanks. Kind of going off that question, actually, the CDC is reporting that most, but not all, cases of monkeypox have been found among the LGBTQ+ community. And I was wondering what DHS is doing to reduce stigma around that and make sure that the people that need it are getting care.
Yeah, it's a good question. And it's an important conversation because we want people to know who is at risk, and that information is important to share. But we also want to make sure that people understand this is not a disease that affects only people who identify as LGBTQ. Anyone can get it, and it's important when we communicate about it to avoid language that can shame or marginalize people. So I tried to model that just now and say that it happens to have been spreading in communities among people who have had intimate contact with others, but it's not specifically an STD. Everyone is at risk, and you should know everyone is vulnerable. Some people are at more risk than others, and you should know the signs and symptoms and feel comfortable talking to a medical provider to get tested when you need it.
Thank you for that. Let's go now to Scott Gerard, the Cap Times.
My question's been answered. Thank you very much.
Thank you. Monique Lopez, Fox 11. Monique, do you have a question?
Yeah, so with, and I know you said this is different than COVID, but is this different in the way that we are more prepared or know more information than, we did with COVID, where we're, able to prepare better?
Yeah. I would say we're much better prepared, and we have the advantage of knowing more about this virus and already having vaccines that we believe are effective. So those are several strategies, and it's a less rapidly transmissible virus. We've learned a lot of things about contact tracing. We've talked about it many times publicly. Those same skills, those same tools are used by local public health for this outbreak as well. So I do think we're well prepared, but the biggest difference, I believe, is, and also the reason that we also want to emphasize the fact that people should know, and healthcare professionals should know that testing is available, is that when we do test people, we have things to offer. We didn't have that for most of the first year of the COVID-19 pandemic. Right now, if someone finds out that they were exposed to a person with monkeypox, we can offer a vaccine as post-exposure prophylaxis, which can keep them from getting sick and potentially keep this infection from spreading further in the community. So many advantages in the current outbreak.
Thank you. Gotcha. Caroline Reinwald, WISN. Caroline.
Yes, thank you for taking this call. You said that the risk to the general public is low. I know you can't get into too much specifics about the Dane County case, but can you tell us the characteristics about this case? This person who contracted monkeypox, do they have an exotic job? What puts them in a high risk category that they would get monkeypox?
Yeah, sorry, I can't share more information about the individual, and I hope you understand this is just to protect privacy. So we want people to understand the facts about monkeypox in general, how it's spread, what to look for, and when someone presents to, someone either goes to a healthcare provider or a health department because they have some concerns. At that point, we take extreme caution to protect people's privacy and confidentiality, because we want them to know that their privacy will be protected, and that all the things that we do to help them identify potentially other people who are at risk will be done in the most sensitive way that doesn't put their privacy and confidentiality at risk. So we have to take that very, very seriously, and that involves not sharing other specifics.
Okay, well, sure. And if that's the case, then can you tell us what other people may be at risk if they're in high risk positions, or is there anything that people can do to, reduce their risk then?
So to reduce their risk, traditionally, before the current outbreak, it was the risk factors were predominantly people who worked with animals and exotic animals. And in 2003, Wisconsin was involved in an investigation of the same virus, monkeypox virus, that was transmitted from prairie dogs as pets. That's not the story in the current outbreak. The current outbreak is resembling a sexually transmitted infection, and it to the present moment has largely been spreading within networks of men who identify as gay, bisexual, or other men who have sex with men. So that information is useful to know how it's transmitted and what people should look out for. But again, it's important to know that this is not strictly sexually transmitted, and people should be aware that the virus is present, and people who may have symptoms should find out, and they should take care to not potentially expose other people if they have characteristic lesions, and they should be able to find a healthcare provider to get tested if they have concern. So when we say that risk to the general population is low, what we mean by that in part is that it's contained and containable. If we can find individual cases, get them linked to medical care, to public health, we can find the people who are at risk and who need to worry. And if we do that well, then the general population who hasn't exposed, if they're not hearing from us, they can feel comfortable that they're not at risk. So it's really it's a team-based approach between public health and people who may have symptoms and people who may have been exposed. And we work, again, in a way that tries to protect everyone's privacy and confidentiality of their healthcare information, to find the people who are at risk and get them the support and treatment or the prevention services that they need.
Thank you. Now to Marcus Arsvold, WMTV. Marcus.
Yes. How do you decide if someone is going to need a vaccination or not? And is that impacted by whether or not they've already had the chickenpox?
Good questions. It does not matter whether someone has had chickenpox. So that's a different virus. And to the best of our knowledge, having immunity to chickenpox, either from the chickenpox vaccine, wouldn't protect you against these orthopox virus, which include the monkeypox virus and the smallpox virus. So if, and the other part of your question was, I'm sorry, I answered the second part, but I forgot the first part.
If someone is experiencing symptoms and they get tested by a healthcare professional, how will they decide if they're going to get vaccinated or not?
Sure. Yeah, that's a good question. So if someone is developing symptoms, if they test positive, they already have the disease, we wouldn't use a vaccine for that person in that context because they're already infected. The vaccines have benefit by either priming your immune system to respond and prevent an infection if you're exposed to the virus. And in this case, also, even after you've been exposed to the virus, but before you develop a clinical illness, a vaccine can help prevent a clinical illness. So vaccines are to prevent monkeypox disease. People that have monkeypox disease, meaning they've got symptoms, they have skin lesions, for the most part, this is a self-limited, meaning it goes away on its own after a week or two, type of illness. And most people have not been terribly sick, and few people have required hospitalization, although it is important for them to isolate at home and stay out of situations where they could be in close contact with other people, including skin-to-skin contact. So we recommend they stay home from work until their lesions have healed over. If someone is at risk for severe monkeypox disease, there are new treatments available, also available not in the general marketplace or in pharmacies, but through the CDC. And we at DHS can help facilitate getting antiviral medications that, again, haven't been in wide use, but are available in emergency situations. Most people don't need that. It would be people who have severe immune deficiency or really severe symptoms at the time of presentation, we would consider using that. Most clinicians don't have experience using this drug, so CDC has stood up a clinical consultation service. We at DHS can talk with clinicians who have patients, if they test positive for monkeypox, and help make that determination whether someone needs treatment. But vaccines itself, at this point, are for prevention and not treatment.
Thank you. Now to Terry Kavorak, WHBY. Terry. WHBY. All right, then our final question to Nathan Denzen at PBS Wisconsin. Nathan.
My question was already answered. Thank you.
All right, wonderful. Thanks to you all. Thank you again, Dr. Westergaard, for participating in this call. If you all have a question that comes up that we didn't get to, please reach out to DHS Media, and we hope you have a safe and healthy holiday weekend.
Have a good weekend, everyone. Thanks for joining.